welcome to my YouTube channel Ayurveda Basket. So as you know, we have successfully completed our first part of the video in which we have discussed the first examination heading, that is our sporting part. Next we are going to very important things in our video, and let's start our video. So first is second part. In second part, second question is there in there are actually three or two subheading. First is you have to identify grahya and agrahya, and your exam in our syllabus is example is given mushta and vidanga. Since mushta having a adulterant is vidanga, so there will be one vessel and two of the drug is mixed, and you have to separate them. Okay, so maybe they are the drug which is having adulteration or the similar shape like that. For example, here you can see this Jyotishmati and Bakuchi. Sometimes we can't differentiate them, so they will mix it and you will say separate the Jyotishmati and Bakuchi in separate vessel. Okay, so for this exercise you should know the genuine drugs characteristics. Okay, and that you will have to study the genuine Kiraya Lakshana along with the picture of that particular drug. This is for Pippali. First is your simple Pippali, Piper longum. Then this is a Gaja Pippali, somewhat wide and somewhat long. Next is Unda Pippali, that is Pippaloids. Okay, so question can come, separate the Pippali from Gaja Pippali or Unda Pippali. So you should know these three. Next is this your Ashwagandha and Shatavari. Sometimes there is a confusion between Ashwagandha or Shatavari because they having similar color or kind of root. So study their Grahya Lakshana. This is your Balerica and Chebula. In Chebula, Haritki is having the rinse, a longitudinal structure. But in Balerica, it is a somewhat circular, so it will be a smooth and not having the ridges. So you can easily differentiate. This is your Erand and Kapikachu. Erand has caruncles. Caruncle is, as you can see, the structure is here. This one is caruncle. Okay, but in Kapikachu, it's having like, I will draw like this kind of structure. Okay, and this Eranda is having this kind of structure. So don't forget them. Okay, then and the B part is Mishraka Gana. I have here added the shloka with the image and all the important Mishraka Gana. So I think maybe like that there will be 2 or 3 vessels and they will say it is one of the Mishraka Gana. Identify the missing Mishraka Gana or identify which is this Mishraka Gana. Like they will take Amal ki, Vibhit ki, Harit ki, and they will say identify which is this Mishraka Gana. Or they can give 2 drug and they will say write the missing drug, and they can ask the importance of that Mishraka Gana. So first is Triphala. As we know, Triphala having 3 main ingredients. This is Chebula, that is Haritki, Balerica, Vibhitki, and this is Amalki, and it is basically Chakshusya, Deepana, Ruchya, Vishma Javaram, Nashan. Second one is Trikatu. It's also known as Triushna, Katudrya or Vayosha. It's having Pippali, it's having Vishwa, it's having the Maricha, and it's basically Deepanam, Hanti, Swas, Kasam, Tvak, Aman, Gulma, Meham, Kapasthola, Meda, Shleep, the penis. At least remember 3 or 4 indication. You have already studied this portion for your exam. Okay, what is the Chaturushna? So this can come, they will keep this Triushna and then they will say add 1 ingredient and make it as Chaturushna. So when you add Pippali Moolam to Pippali Shundi and Maricha, it will become Chaturushna, and it's having the same kind of property, but it's a Adhika Ukshna. It's more Ushna property as compared to Triushna. Next one is a Panchakola. As you know, Panchakulma is very famous. Okay, Pippali, Moolam, Chavyam, Chitrakam, Nagam, and every one of these have to take Kola Matra. Kol, as you study in RM, it's a 6 gram. So Pippali is Piper longum, Piperacea family. Pippali Moolam is Piper longum, but here in Pippali we are taking a fruit, and Pippali Moolam we are taking the moola of that Pippali. This is your Chitraka, that is Plumbazo zelenica, Chavyam Piper rectofarum, that is Piperacea family again, and Zingiber officinum, Gingibraceae family. So all of this, when you take 1 cola, it will become Panchakola, and Panchakola is having Tikshna property, Tishna, Ushna, Pachanam, Sreshtam, Deepanam, Kapha, Vadnut. It is used in the condition like Gulma, Pleha, Udra, Shulaganam, and Pitta Kopanam. Next is Sadoshna. If you add Maricha to this, it will become Shadoshna. For example, in Treushna, when you are adding Pipli Mula, it will become Chaturushna. So similar like that. In Panchakola, when you add this Maricha, then it will become Shadushna. And it's having a property of Vishapaha, antitoxic. Next is Trimada. Oh, I have one question for you. Comment why it is known as Trimada. Okay, I will give you one hint also. 3 means 3. Mada in Ayurveda is intoxication. Okay, as you all of agree now, this is intoxication. So why these 3 drugs are known as Trimada? You have to give me answer in a comment section. Let's see who know the concept behind this. Okay, so 3 Mada, there are 3 things: Chitraka and Vidanga, Krimigana, Prabhava having, and this Musta, Plumbazo Ambelia ripes, and Cyprus rotundus. Next one is 3 Jatak. Again, very famous one. Tvak Ela Patra, and if you add this Naga Kesra, it will become Chatur Jatak. And generally having the Rochna property, Ruksha property, Tikshna Oshna, Madhu Gandha. Okay, and Tvak is actually your Dalchini, Cinnamon Zelenica Lauraceae family, and this both actually belong from same family. Teja Patra is the Cinnamon Tamala and Lauraceae family again. Ala is Elateria cardamom, Zingibraceae illaichi in Hindi. Then Chatur Jatak, when you add Naga Kesra to it, that is Mesua Piraya. Okay. Next is your 3 Karshika. So here we have to take 3 ingredient Karsha Pramana. Karsha is the 12 gram. So one is Shundi, Ativisha and Musta. So 3 of the drug is known as 3 Karshika. Chatur Bhadra is 4 drug are there, and actually what happened in this 3 Karshika, you just add this Guduchi, it will become Chaturbhadra. Shundi, Ativisha, Musta along with Guduchi is known as Chaturbhadra. And next is Bala Chaturbhadra. Okay, in first part when I am giving that Karkata Shringi, I have mentioned this thing. Okay, so don't forget this thing because they can ask it. Okay, so in Bala Chaturbhadra, 4 ingredients are there: Pippali, Musta, Ativisha and Karkata Shringi. Next is Chaturbija. Since nowadays you can see everyone, it is this flax seed or chia seed or pumpkin seed and all. In Ayurveda also we have this seed concept, and the 4 important seed under the heading of Chaturbhuja explain is Methika, Chandrasuram, Yavanika or your Ajwain, and Kalajaji, that is this Kalonji. Methi is simple methi. So this 4 is constituting the Chaturbijam, and its function is it will cure your pavana. Pavana means every diseases generally have origin from vata or in the later stage or in the early stages. So it will cure that vata's gati, and vata is always having that gati na. So when it go normal, above normal, for example, it's having always downward gati, when it is moving upward, and it will cause many diseases. So this Chaturshura, when you eat, it will nihanti the pavanamam, it will cure the disease related with the pavana like ajirna, shulam, adamanam, parshvashulam, kativyada. Okay, and botanical name all are written, you can study. Next is Panchavalaka. Panchavalaka is actually your Shrira Vriksha, in which ficus plants are there: Nigrodham, Udambram, Ashwatam, Parisham, Palaksham, Padapam. This is also known as Shira Vriksha. For example, Vat is there, Udambara is there, Ashwata is there, people and all. Okay. Next is Panchatikta. It is important. Okay. Panchatikta is actually very bitter 5 plants are there. First is Nimba, Asati rectandica. As we know, it's not Lauriaceae, it's Meliaceae. Okay. Next is your Tinospora cordifolium, because it's also Tikta Rasa Pradhana, Menispermaceae family. Then Adathoda vasica is your Vasha, in which we are using leaf as official part. Brahati is Solanum indicum, Solanaceae. And Patola, Trichoxanthus dioecium, Cucurbitaceae family. Okay, that Kaddu and Ghiya family basically. Next is your Bhrita Panchamula. Bhrita Panchamula is very famous. Bilva, Agni Mandam, Tintukam, Patla, Kashmari. And one like 5 ingredient of the Dashamula, like Vilva, Eglima rutaceae family, Kashmiri, Melania arborearia, Verbenaceae family, Padla Stereospermum solviensis, then uske baad Agnimanda, Primna ceratifolia micronata, then Shonacum, Tintucum, Oroxylum indicum, and it's having the function like Kapha Vataganam, then it's Madhura Anurasam. Okay. Next is your Lagu Panchmula. When Bhrita Panchmula and Lagu Panchmula came, it will move your Dashamula. So in Lagu Panchmula, as you know, 3 Kantak is there, Bhriti is there, Dvibhriti, Prishniparni, Vidari, Gandhi is there. So Gokshura, Kantakari, Brihati, Shalparni is also known as Vidari Gandha and Prishniparni. Next is your Lagu Panchmula and Bhrita Panchmula is your Dashamula. Simple. Valli Panchmula is who having a Valli or climbers. Then first is Vidari, Shariba, Ajasirangi, then Guduchi, and your Rajani or Manjishta. Okay, so Rajani and Manjishta, these are your Valli Panchamula, and its indication, it is very good for Rakta Pittahara, and it is a Thresh of Nishan in Vinashini. In Acharya Charaka Sutra Sana explained that the shofar of 3 types. So all the 3 types shofar is managed by this Valli Panchamula. Okay. Next is this Kantaka Panchamula, and this Valli Panchamula and Kantaka Panchamula having the same clinical action. Rakta Pittam Haram, Shofatra Vinashini. So it is having Karamardam, Gokshram, Sairikam, Satavari, and Gridranak. Next is Trina Panchamula, in which all belong for Poaceae family or grass family, and they are basically used for Mutra Dosha Vikara or Rakta Pittam Haram. For example, Kusa, Kasha, Nala, Darba, and Kandekshu or your sugarcane. Panchamula is Lagu Panchamula, Bhrita Panchamula, Valli Panchamula, Kantaka Panchamula, Trina Panchamula is constant Panchamula. So this completed your Mishrika Gana. Third heading of this second question is clinical scenario is there, and you have to select 5 suitable drugs, and 10-minute time is there. So first I have written one case scenario here. A 26-year-old female present with a recurrent episode of breathlessness, wheezing and cough for 2 years. Symptom worsen at night on exposure to dust and cold air. She feels relief in sitting posture and cough in associated with the scanty expectoration, diagnosed as stomachus vasha. So selected drug is Kasahara drug. For example, Vasha, very good because it's having a synonym of Kashotpadnam also, Kantakari, Pippali, Bharangi, and Pushkaramula. And I have written the rationale also, so you can write this to get more marks in paper. Second, for Prameha, and a patient is complained with the excessive urination, increased thirst, fatigue, and weight gain for 6 months, sedentary lifestyle. So we have to give him the Prameha Gana drug. Along with that, this sedentary lifestyle also. So Mesha Shrangi is also having a synonym of Madhu Vinashini. Then Vijyasaram, Haridra. Haridra and Amalki is very best for this Prameha and all, and this Guduchi. For Vata Rakta, a patient of 44-year-old patient with sudden severe pain, redness, and swelling of the great toe. Since here the big toe, the Adya Roga is always having this kind of manifestation also, burning sensation, and tenderness is noted, diagnosed with Vata Rakta. So Vata Rakta is Agra is Guduchi. Again Guduchi is there because anti-inflammatory, reduce uric acid effect. Then Manjishta is there. Then your Gokshura, again this Muttala, so it will reduce the inflammation. Then next is our Punarnava and this Eranda. Eranda is also very good for inflammation. Punarnava also. Next for Arshas, a 38-year-old male complained of bleeding per rectum and pain during the defecation for 2 months, and diagnosed with the Rakta Arsha. So Rakta Arshas, we have to stop this bleeding, and we are taking this Haritiki Anulomana action, and this Naga Kesara, Daru Haridra, and this Triphala, improve your bowel movement and all, and Arshogana drug like Bhallatka is there. So we can use them. Then Pandu, iron deficiency anemia, present with the pallor, fatigue, and breathlessness, exertion, and dizziness. So its drug is Amalki. You know, for this iron absorption, vitamin C should be there. So Amalki you have to take along with your this iron supplement. It will enhance the iron absorption. okay. And vitamin C is very important, and in Ayurveda, like Amalki is saying, you can take it daily. Punarnava, since it is a Vyasthapak, Punarnava will also correct your Agni and improve your hemoglobin. Draksha is very important in this iron deficiency, anemia and all. Then Haritki, it will improve your digestion, Anulomana action. And Mandura is actually your iron preparation. Next, for Gridrasi, the case scenario like that: a 46-year-old male present with the radiating pain from lower back to the posterior aspect of the right thigh for 4 months, and diagnosed with the Gridrasi. So Gridrasi is again Vata Vyadhi, so we can give Aranda because it is a Vata Shamakam and relieve the radiating pain. You can give also Sahachara also. Then Rasana, and again anti-inflammatory, Nirgundi, Dashamula and Yogaraj Gulu. Next, for Atishara, a 29-year-old male present with the frequent loose stool, abdominal cramp and weakness for 2 days. History of outside food intake is present. So Atisara. So Atisara actually of two type. One is Amatisara and next is Pakwatisara. So based on that, you have to give the drug. Okay. For example, if you are giving this Kutaja is a Shita Virya, so it is good for this Pakwatisara, and maybe it's not that much good for this Amatisara, because in Amatisara you have to give Ushna Virya drug. Okay, so Musta you can give, Amalki you can give, Bilva you can give, and you can give that Shalmali also if it changes to Raktatisara. Mutra Karichara is a 34-year-old female complaint of burning, maturation, like increased frequency and lower abdominal pain, Pittaja Mutra Krishna. So Mutra Krishna we have already studied. In Agra it is a Gokshura, and Punarnava that reduce the inflammation. Chandana is also good, Guduchi and Varuna. So this drug we can suggest. Vicharchika, eczema, oozing, itching, oozy skin lesion over the leg for 3 months. Symptom worsen after sweating and junk food intake. And this rational drug is neem, because it is antipruritic, antimicrobial, prevent the infection and all also. Manjishta, again Rakta Shodhana, reduce the oozing. Khadira, specifically good for this Kushtagana drug. Guduchi, immunomodulator. Haridra, anti-inflammatory. Haridroga, the scenario is like that: a patient is having the chest pain radiating to the left arm, so again it's a MI patient, and we can give that Haridya Prabhava drug Arjuna. Then Pushkara Mula, Lasuna is also having a cardiotonic action. Gugulu, clear your Srota Roda. Guduchi, Rasayana and stress reducer. So drug selection is basically based on the dosha predominance, Sroto Dushti and Agni status. So this kind of question can come, and actually in our like Dravya record we have written I think 15 case scenarios. So like in your college they can give the same scenario from that also, and this kind of small scenarios also come. You have to write accordingly which part is asked. Generally they will ask what is the diagnosed, or which are the drug you will suggest for that particular patient, what is that kalpana, what is the dose and the time for intake. So this kind of question can come. Third part of our paper is the QC practical, quality control, and they are actually performance based component. First you have to do the comparison of macroscopic evaluation of one genuine and one adulterated drug. Okay, so I have written here macroscopic evaluation will be coming. For example, this is this Punarnava, Rakta Punarnava, Shveta Punarnava. You can study this portion. I have shared the main slide on the Telegram channel. Okay, then this is your Terminalia Arjuna and its adulterant Tomentosa also. Next is Tinospora cordifolia and Tinospora malabarica. So this you study. And 3.2 is we have to do the pH of a given plant sample or quata. So it is of 10 marks. There will be sub question and you have to perform the pH according to the standardized procedure, and I have shared one of the best PPT for this pH on the Telegram. You just check from there. 3.3 subheading is we have to do the specific gravity. So specific gravity is basically for 20 marks, pH for 30 marks, and for this I have already shared one of the PPT. You can watch from there, and in that PPT I have included all the important points are there and sub questions are there. like what is the procedure, what is the apparatus use, all those questions are there. And the last portion is our viva. Okay, for viva is 10 minutes per student is there, and these are the major topics that is given. Fundamentals like Dravyaguna, Virasa, Virya, Vipaka. So like 3 questions or maybe lot are there, so you have to pick the lot and give a answer accordingly. Then for karma and dashamani mishra ka gana 3 question is there. Then pharmacology is also question is there, and from network pharmacology, clinical application of drug, like same we have done our clinical scenario. Teacher can explain you one case scenario like that, and you have to select the drug and give the rationale why you select that drug. Then vibe on your practical record and communication skill. So this all constitute 200 marks. First you have to do the spotting, and 30 spotting will be there, 15 dry drug, 15 the fresh drug. Then skill based your 30 marks. First you have to do that grahya grahayata, then you have to do that mishra ka gana, and one more component is there, you have to do that. Then this case scenario, so this 30 marks. Then QC you have 40 marks, 20 marks for your specific gravity, 10 mark for your pH, and 10 mark for your macroscopic analysis, 70 marks for the viva, and internal assessment that is already done, 30 marks. So these are the total 200 marks, and we have completed our here Dravya all aspect of the practical. So the very very best for all those who have the exam and who had done exam. Congratulations to them, they have already overcome this whole things. So okay, thank you guys.